Having grown up in Brooklyn, I know firsthand the work of Brooklyn Legal Services Corporation A. For over 25 years, they have served and interacted with the residents of Williamsburg, Brownsville, and East New York, building collaborative relationships that are a crucial foundation for community empowerment.
Brooklyn, at one time America's fourth largest city, home to 2.5 million people and a multitude of languages. The Brownsville section is a low-income community whose residents struggle daily to survive amidst overwhelming problems of substandard housing, systemic unemployment, and inadequate health care. But on the corner of Blake and Rockaway Avenues in the heart of Brownsville is a new 27,000 square foot family health center. 3 years ago, this was an abandoned supermarket. Today, the Brownsville Family Health Center annually treats 55,000 people. This facility is totally unique in the state of New York, both in its groundbreaking approach to the delivery of health care in a low-income community and in the precedent-setting approach in which it acquired funds to build the center. Lastly, the center's success is the result of a unique relationship between Paul Achinapura, Associate Director of Brooklyn Legal Services, and Maurice Reed, Executive Director of the Brownsville Family Health Care Center.
Right at the outset of the corporation, we made contact with Legal Services Corporation A, and they incorporated the organization and has essentially served as our in-house attorneys for the last 15 years.
At that point in time, in our communities, very much like other poor communities in America, the providers of primary health care services were either the ER rooms, the emergency rooms of the local hospitals, when they would see our clients, when they would see the residents of the communities, and the Medicaid mills, which existed on the commercial strip that runs through the heart of Brownsville. Brownsville Community Development Corporation decided that neither one of those models of delivery of health care was an appropriate mechanism through which the residents of our community ought to receive health care. And so it decided to become itself a provider of health care services, choosing to address this problem by taking on the responsibility of it itself to create what in New York State is called a diagnostic and treatment center, which is a community health center.
The Family Health Care Center opened its doors in August of 1982. Yet within 4 years, the center was in desperate need of expansion. Even though they had located an old supermarket in the neighborhood where they wanted to move, funding for the expansion was impossible to find. Paul and Brooklyn Legal Services began a search for alternative sources of financing for the healthcare center expansion.
And in doing research in the New York State statutes, I came across a mechanism which enabled the state of New York, through one of its entities, to sell tax-exempt bonds to the public and to make the proceeds of those bonds available, the money raised by the sale of the bonds, available to hospitals for the expansion of healthcare services. While we were then and are now a community health center, if you look at the New York State statutes, the word hospital not only includes what we might normally think of as an inpatient hospital where you stay for 2 or 3 days, but the term hospital in New York State law is a term of art, which means that it also includes other institutions and other entities. And underneath, buried in line 11 or line 14 of the definition of hospitals, you see a reference to diagnostic and treatment centers. And so we believed that we were legally entitled to make application to access the mechanism of the sale of tax-exempt bonds to raise money to do this.
And in 1985, for the first time in New York history, tax-exempt bonds were sold to fund the expansion of a community health care center. Thanks to Paul's reading of the New York State statutes, the Brownsville Center now had $7 million to acquire and renovate its new home.
We provide a full range of medical services to the community. That includes pediatric services, adult medicine, including internal medicine, obstetrics and gynecology. We do x-rays, dentistry, podiatry, optometry. I like to tell people when I go out that it's like having 17 doctors in the same place, and that's all you think about. Just don't look at it as a big facility. Just you're going in to see your doctor, and we'll provide the care for you.
I think one of our selling cards for this center is that you not only get excellent clinical diagnosis and treatment and care, but you get it presented in a very caring, compassionate way. So it makes people want to come back to us. I've had patients who have left the area, have moved as far away as Queens, the Bronx, who will still take the time and trouble to come back to the center because they found a physician or a group of physicians, because I believe not just in pediatrics or not just myself, but I think in OB, I think dental and medicine, and also the WIC program, other support programs we have, that you get a compassionate care that's provided to people. And I think that's a very good drawing card.
We don't come in on a white horse providing answers. We are not the saviors to the problems faced by our communities and the residents that live there. We are participants in a community-driven, community-controlled response to injustice.
I think the strength of our relationship is that we've learned together. And he's brought information to us. We've researched things together. We've broken ground together. And it's a kind of relationship that I don't think you get outside of this kind of milieu where you have a community-based organization working with a community-based attorney.
If the larger infrastructure of our society is not going to provide us with decent, appropriate health care, we can do it ourselves. It's a professionally and personally rewarding experience to be part of a unified response to a problem, a response controlled and directed and influenced by community residents coming together and saying to one another and to the world at large, we can make a difference for our neighborhood. We can make a difference for our community. We can overcome these challenges, and we are going to assert control over that portion of our life that involves, in this case, healthcare.